Hello and welcome to another edition of Sri's Sunday New York Times Read Along. Our guest this week is Dr. Adeeti Gupta, founder and CEO of Walk-In GYN Care. Our host, of course, is Sri Srinivasan. He is the managing director for ASU's Cronkite School of Journalism's Cronkite Pro and the co-founder of Digimentors, a digital and virtual events consultancy. My name is Neil Parekh. I am the executive producer and occasional guest host of the show. We are live on Facebook, Twitter, LinkedIn, YouTube, and our Digimentors website. We're also live on the Walk-In GYN Care's Facebook page and their Twitter account. Thank you so much for joining us. Please like, please comment, please share, please tag a friend who would be interested in this very important topic, focusing on women's health. To give you a preview of what's to come, here's a quick teaser video. And then after that, we'll get into the show. Our guest on this week's edition of Sri's Sunday New York Times Read Along is Dr. Adeeti Gupta, founder and CEO of Walk-In GYN Care, a series of clinics that provide comprehensive same-day women's health services to all women when they need it. All they have to do is walk in. Some of the topics we'll discuss: the lack of access to high-quality care, the impact of physician shortages and rising costs, the sharp rise in STDs in the last 3 years, and the importance of preventative care. In the wake of the Supreme Court's decision to overturn Roe v. Wade, we'll also talk about the need to encourage women to focus on birth control and how to find qualified women's health providers in case they do need an abortion. By providing walk-in services, Walk-In GYN Care has been able to identify hundreds of cases of breast, cervical, and ovarian cancers, cure thousands of STDs that are known to cause newborn deaths, and reduce emergency room visits by 40%. We will also cover the latest updates on the assassination of Shinzo Abe, Japan's longest-serving prime minister. Sri Srinivasan is our host. I am the executive producer and occasional guest host, Neil Parekh. Paula Kiger helps produce the show, engaging with the audience on Facebook and LinkedIn. Sri has been hosting the New York Times Read Along for 6.5 years, with some amazing guests. The show is produced by Digimentors. We produce high-quality virtual and hybrid events for organizations big and small around the world. We also do social and digital consulting, training, and workshops. Again, Dr. Adeeti Gupta is our guest, live on Facebook, Twitter, LinkedIn, YouTube, and our Digimentors website. That's a little bit of a preview of what's to come today. Again, our guest is Dr. Adeeti Gupta, founder and CEO of Walk-In GYN Care. Let's take a quick look and see who is watching today, who's joined us so far. Our good friend Jonathan Borstein is saying hello from the East Village. Jonathan, always a pleasure to have you. Stephen Kaplan is joining us from Ramsey, New Jersey, saying hello to the New York Times Read Along family. Thank you very much, Stephen. And yes, this is a family. We have a regular group of people who watch every week, and we really do appreciate your loyalty, and you're taking some time on your Sunday morning to join us. Diane Stefani is watching from Margate, New Jersey, and she's thanking us for this very important guest and topic. Thank you, Diane. Glad that you could join. Patricia Freudenberg is watching as well from New York, watching on LinkedIn. Again, we're live on Facebook, Twitter, LinkedIn, YouTube, and our Digimentors website. We also want to say hi to everyone watching on the Walk-In GYN Care's Facebook and Twitter accounts. My mom is watching from Hastings-on-Hudson. Hi, Mom. My mom is a very loyal watcher. She catches almost every show. She watched one from a taxi when she came in from India one year. She logged in. I didn't expect her to watch that day, but she did. Thank you, Mom. Debbie Bernick is watching from DC. Debbie, thank you. Miriam from Hell's Kitchen, Emily Silverman from Philadelphia, and Ken Fisher watching from Iowa. Let's go ahead and bring on our host, Sri Srinivasan. Sri, good morning. Good to see you.
Good morning, Neil. Great to be here. Great to see you. Thanks to you and Paula for putting the show together as always. We have such an important guest, an important topic on a very newsy weekend. In addition to everything that's been happening in the US that we've been following, of course, there's also the assassination of the former Japanese Prime Minister. The developments in Sri Lanka have made the front page of the New York Times because it's been so disturbing. The images that people have had a chance to catch on TV, stunning stuff, and the country in deep, deep turmoil. So I'm glad that we'll be able to talk about all of this as we focus as much as possible on women's health issues today with Dr. Adeeti Gupta of Walk-In GYN. And we are grateful to everyone who's watching. Please tag us and please hit share on these platforms. Your friends can watch live or later. This will restart on all the channels as soon as we're off the air on Facebook, Twitter, YouTube, and on LinkedIn. So tag a friend, someone who you know would enjoy talking about the news, understanding what's happening in the world, or cares about misinformation, disinformation. We do this on Sunday mornings at 8:30 a.m. Eastern Time. So please share this and share your thoughts on your Sunday and on the news and everything that's going on. We are very grateful to our wonderful audience for being here. Let's bring on our guest in a couple of minutes. We are just going to take a look at the paper, and then we'll have Dr. Gupta with us. So I want to start by showing you our New York Times camera. And here you see the front page. We'll look at this again with Dr. Gupta. The lead story is Fearing Oil Jolt, UN pitches plan on global prices, a story about the Ukraine war. Investigative story about sexual abuse in the junior ROTC. This is the Reserve Officers Training Corps, a way to get people interested in the military at universities. And this is the junior junior ROTC. This is the Sri Lanka story. And then in A City of Joy and Grief in Lviv, Ukraine, babies are born just steps away from where fallen soldiers are laid to rest. And a New Hampshire town's lesson in democracy. And Biden at 79 shows signs of age, and aides fret about his image. So this is what's going on in the White House. So lots to talk about with on the front page. The magazine cover is The Time of Your Life. Researchers are trying to figure out the right hour of the day to do everything. Can their studies sync us up with better health? So what a great topic to discuss with our physician guest. The Arts and Leisure cover is and appearing in a cameo. The laptop, serial, or website isn't popping up in movies and TV shows by chance. Here's how product placement works. I'm sure you've wondered about that. All those Apple and Dell computers on various shows. The book review cover is Atlantic Antic. In the shores of Bohemia, John Taylor Williams evokes Cape Cod's heyday as an artistic paradise. And the Metropolitan cover is A Dark Secret Changed a Friend's Life. Tin Shin and Mo Lin were inseparable at the homeless shelter, but one of them wasn't who he seemed. This is Sam Dolnick's piece. A real estate cover is The Only Certainty Right Now is Uncertainty. And that, of course, I think we all experience and feel that. And here's the Sunday Review cover, The Mayor Who Never Sleeps, about New York City's Eric Adams. The Sunday Styles cover, Prozac Nation was just the beginning. The pandemic's toll on mental health can be glimpsed in the rising use of prescription drugs. And the business cover is When Tabloid Fiends Need a Friend. Arthur Didella's law practice specializes in headline-grabbing defendants who are hated by many. and lonely last days in a suburban office park. So, lots of interesting things in the newspaper, and we are looking forward to discussing all of that, as well as lots of questions and answering your questions about women's health with our special guest. So, let's get to our guest and let's tell you a little bit more about her. Our guest is Dr. Adeeti Gupta of Walk-in GYN Care. She's the founder and CEO of these wellness centers, and we are delighted to have her with us.
Hi, Sri. Thank you for having me. It's such a great thing that you do every Sunday. I'm going to become a loyal watcher after this for sure.
Sri, we lost your audio. Can you? Sorry, Dr. Gupta, we lost Sri's audio.
Yeah.
So we'll just get him in 1 second.
I was having trouble hearing.
Great. We can hear you now, Sri.
Okay, great. Thank you. I'm sorry about that. Tech issues, Dr. Gupta. Better to have it on our technology than all the technology you have in your centers. Good morning and welcome. Thank you for being with us. My first question always is, where are you this Sunday morning and how are you doing?
I am doing great. I am in Manhattan right now, and I'm speaking from my home. So thank you for having me.
Are you a morning person?
Very morning person. I try to get my workout, not try, I do diligently get my workout every first thing in the morning, 5:30.
5:30 and even on Sundays.
Sundays, guess 6 o'clock, 6:30. I
So you
force myself to sleep extra because the body needs the sleep. So
how were you always a morning person or did you become one later in life?
actually, I was not a morning person. In med school, I was pulling late nighters, all nighters, studying. My brain used to be more awake at night, but I changed my entire schedule as and when I started opening my, the entrepreneurial hat and came to the US where OR and everything starts super early. But the morning schedule works out much better because you get the workout out of the day, you're fresh and ready to go.
So you're living proof that people can change their body clocks if they need to.
Absolutely.
Okay. So we're going to be talking a lot about what's happening in the news. And of course, women's health is at the forefront of a lot of conversations here in America and around the world. So let's first get to know you a little bit. Please tell us about the work that you do. And maybe we can even start with how you decided to focus on women's health.
Okay, so I'm an OBGYN. I did my residency and medical school back in India in 2000, yeah, 1997. I came to the US in 2004 and repeated my residency here. And women's health was very important to me, even from being in India, seeing, how women are treated, have lack of access. And then when I came here, I realized that there was not much of a difference here. An average women's health appointment took almost 3 months to get to, and women were like spending the entire day trying to get to the doctor's office, even for a minor issue. So then an idea was born, and then in 2014, I opened the first ever walk in centers for women's health. And the reason I say first ever is there was no center that was focused solely on women's health with same day appointments for comprehensive care, urgent care visits, all of it. So yeah, and then I opened the first center in Manhattan, in right near Columbus Circle. Became so busy with professional women, all women coming in morning, evening, lunch breaks. And then I just expanded to Astoria, Brooklyn. Actually, Brooklyn Center opened right in the middle of the pandemic, which was really, really good for women because all other offices were closed. And then now I'm in Bayside and actually just opened one in Los Angeles, and I'm opening one soon in Staten Island. So thank you to all the New York women who helped get this started.
Congratulations on all your success. How did you know that this was a gap in the industry, and what was the kind of research you did to know that this would be successful?
So when I was doing labor and delivery calls in the hospital, we would get a call, at 2 a.m. for a woman with, urinary infection or a vaginal infection, which didn't really require her to be in the ER, wait for 6 hours, and spend hundreds or thousands of dollars in their deductibles to get one prescription. And we would see the woman and say, well, this is what it is, and then go follow up with your GYN. And then it's the same story. The GYN appointment is not available for 6 weeks to 3 months. So we did a little bit of research, surveys, called various offices to see, what's their next available appointment. Started researching the name, registered the first professional corporation with the name Walk-in GYN Care PC. So it was very obvious that nothing like this really existed. So started researching for real estate, looked at my budget, and just dived right in with all of my savings. It was a big risk I took, and I'm glad I did it.
Well, that's what entrepreneurship is all about, right? Taking risks and having this success. And tell us where people can learn more information about the website, etc.
Straightforward, walkingyn.com. It's very easy, or just call us. LinkedIn, we are on Google all the time. So LinkedIn, Facebook, Instagram, it's all at Walk-in GYN or Walk-in GYN Care. You Google Walk-in GYN Care, you'll get us as the top listing. It's really easy to find us.
That's awesome and so important what you've been able to do. What has been the reaction among, we can obviously tell that the patients have been very happy, but what has been the response from your peers and your colleagues and your competitors?
To be very honest, I was very afraid in 2014 that I'm going to have competitors. Till date, I still don't have, which I'm not trying to be arrogant about it, but it is just hard, very hard to be able to provide qualified, high quality women's health services on a walk-in basis, because we have to keep our doors open 7 days a week. We have to make sure that our standards are very, very high. Women are treated with compassion. I focus heavily on training of all of our providers. We have about 30 certified women's health nurse practitioners, physician assistants, and physicians. So it's still hard. So that's been the challenge, but we've been able to keep it going. As far as response from other physicians, they actually support this. And we work very well with other urgent care centers, because sometimes women will end up there and they really don't know what to do. So they will send them back to us for STD testing, pain, ultrasound, and stuff like that. So it's been a very collaborative approach rather than stepping on anyone's toes.
And for those who live in America, they know that there's been an explosion of the urgent care centers around neighborhoods and various places. How does what you do, as you said, they refer folks to you and all of that, but they don't typically have these services, correct?
Well, so they do very initial services. So women's health is such a private, as in all the women who are probably watching this know, it's a very private and delicate field. So the urgent care centers have usually primary care physicians there who don't feel very comfortable looking at the vagina. They are taught that in medical school, but anything beyond very basic stuff, they start to get nervous. And this is why we have been able to provide such great collaborative care that we can see, STDs, vaginitis, pain. We can do ultrasound actually on site to detect ovarian cysts and fibroids. So yeah, I'm not saying that the urgent cares are not qualified. It's just that once it comes to more advanced women's health issues, it's better that they go to women's health providers.
Thank you. We have some great folks watching from all over the world, and we're always grateful to them. Here's a question from Patricia who says, who would Dr. Gupta say was an inspirational mentor, past or present, in her mission?
Wow. I've been very fortunate to have a series of mentors from my time in India and here. In New York, I would definitely say, I don't know if you've heard of Dr. Emmanuel Friedman. He's kind of like father of obstetrics and plotted the first ever labor curve. He's now 96-year-old. He's still very active, and he was instrumental in reigniting my passion for women's health, wellness, and preventative focus, and just learning everything from ground up.
Wow. So how did that's amazing that first of all that he's still working and that he was able to inspire you. That's awesome. And Patricia says, "Thank you, Dr. Gupta. Congratulations on your great accomplishments for women's health." Diana's watching from the Bay Area where it's only 6:50 in the morning, or 5:50 in the morning. So thank you very much for watching. And Ellen's watching from the east side, the Upper East Side. Dana says hi, and Patricia also asks, "Are you partnering with telehealth? What do you do with telehealth and telemedicine?"
So funny you say that, Patricia. I actually just launched nationwide telehealth platform. So we already started to offer telehealth during the pandemic, and now I have focused 7 days a week actually telehealth visits. But I just launched a nationwide tele GYN platform where we will be partnering with local OBGYNs in every state and providing telehealth services. Because as you know, women's health does require an in-person visit. So yeah, good question, and I'm really excited that I was able to do that, especially in view of what's happening with Roe versus Wade and lack of access and misinformation spreading about birth control, contraception, and things like that.
That's really awesome that you've been able to do that. Pradnya is watching from Silver Spring, a former guest on our show, and Dr. Sujana Chandrasekhar, host of She's on Call, co-host of She's on Call, and wonderful ENT surgeon, says this is a needed service and a great innovation. So that's great to see that. One of the things that I wanted to talk to you about is the current state of women's health care in the U.S. The Supreme Court ruling has put a focus on the issue of abortion, but if you could just talk a little bit about the landscape in general and what has been the response in the last few weeks to the news among your patients.
There's been a great deal of anxiety, not just among New York, but LA, California, all the states. I suggest that women pay very close attention to their bodies and understand that there are options available to be able to utilize proper birth control in a safe and correct manner. They still need to go and get access to their physicians. My huge suggestion is that please do not try to take your health in your own hands. If you do need advice, you find yourself pregnant, please go to your physician, get completely checked out so that your physician can guide you what to do. Every state is obviously now gone to different laws and rules, and your physician will be the best person to guide you through. Birth control taken in an effective manner can be 99% effective. I can stop here or I can keep going.
Well, just a question about the three options we just saw on
Yeah.
the screen. How do you compare them? How do you describe them to your patients as options?
The three options that we just saw earlier, the pill, the patch, and the injection, they are different types of hormonal contraceptions systems. And some women may or may not tolerate the hormones very well. But if you're able to tolerate this, then they are 99% effective if taken properly. And the reason I keep insisting on if taken properly is because recently there has been a big splurge of these online delivery systems, calling themselves tele-GYN or telehealth platforms, where they're prescribing birth control, hormonal pills via text messages or however. But women have to understand that you still require proper supervision and a visit to the doctor's office to be able to take these birth control systems properly. So this is the hormonal one. And then the non-hormonal one is the option called Paragard or a copper IUD, which actually is an excellent system if your body is able to tolerate it, because it's good for 10 years and you're pretty much free once you get it in. Shri, you're muted again.
What are some of the questions that you've been getting from your patients in the last few weeks?
Mostly just asking again for safe sexual practices and what would happen in case they get pregnant, which is an unwanted pregnancy. But again, our advice is always to get your wellness checkup, start the right method of birth control, and be safe.
And is that a message that you find over your career has been easier to deliver or harder to deliver?
Harder because the guidelines for annual visits keep changing. The recommendation changed to, oh, you're good with a PAP every 3 years or every 5 years. But what women have had a hard time in understanding is that doesn't mean that you start skipping your annual exams. And then if you have a new partner, as we have seen recently, there were 26 million new STDs diagnosed in the US in the last 2 years itself. And this is United States of America, where we are at the cutting edge of medicine, where we should be able to curb this right away. But that's where the situation is. And that's because a lot of these STDs are going undetected, or women are not seeking care, and, Tinder and what else. I mean, so.
And therefore they're not getting the care they need, or they may not even be aware that they
Yeah.
have these, right? And so that's something that we have to worry about. So you're saying that the way that these the way relationships happen now has contributed to the increase in the situation.
The way they happen and the lack of screening, basically women just not seeking care or not being able to seek care.
And this is only going to get worse because of everything now with the confusion that's come in with the Roe v. Wade decision.
Yeah.
And so, as we have people all over the country and around the world, what are some of the tips you would give them?
Monitor your periods, because your periods are the best indicator of what's going on in your body. Your hormones change every month. Your body sort of gets ready for pregnancy right before you're supposed to get a period. So starting the birth control at the beginning of a period is what I highly recommend. That's the safest way. If you have irregular periods and you're not sure, do a pregnancy test at home. Go to your physician and don't just assume that that's normal. And please, please, please go for an annual checkup every year. Your insurance should cover it. If not, cash paying prices. If you have high deductibles, there are many options, but please don't skip your annual visits.
And remind us again where all you have your centers.
Manhattan, Brooklyn, Astoria, Bayside, Staten Island, and Los Angeles.
And that's your expansion to Beverly Hills.
Yeah,
Must have been lots of fun and a big challenge considering you were so New York based.
yeah. I apologize. I forgot Middle Village, which is my main office.
So how did you come about deciding to leave just the New York area and also add LA into that?
I had always been licensed in California. I really wanted to move there, but then due to family reasons, I ended up staying in New York. So that California opportunity became like a no-brainer. And then a physician from there, Dr. Saletz, she is also quite an entrepreneur. She reached out to me about what about we bring urgent care facilities for women's health in LA. So now she's the physician who's managing that office and taking care of patients. And it's been a year and a half of construction and renovations and stuff, but we are delighted that we're able to open our doors literally on April 6th, actually.
What is your advice for other physicians who might be watching who are interested in being entrepreneurs but haven't made the leap?
I'm there to mentor you. I'm there to guide you if you want. It's not easy because we doctors just know doctoring. So, and you can also get taken advantage of by consultants and people who say, well, we're helping you. So getting the right legal accounting help and support is extremely important. And be ready to burn the midnight oil if you need to.
We have some questions coming in, obviously. And folks, if you're just joining us, this is Dr. Adeeti Gupta, who is the founder of Walk-in GYN. She is talking to us about women's health, and we'll be reading the newspaper with us and answering your questions. We'll get to the paper in just a minute. One of the questions that comes up is that there used to be a lot of emphasis on safe sex. We used to hear about that a lot more, I feel like, in the 90s and 80s because of the worry about AIDS. Then it seems that the emphasis changed. Can you talk a little bit about that?
Exactly. So in the 60s and the 70s, even in the post Second World War era, there was a huge emphasis on rising STDs because syphilis was rising at that time. And then in the 70s, it was HIV. So there were very aggressive safe sex campaigns, use of condoms, testing. But then somehow I think our society got sort of comfortable. And then in the 90s, because the rates were low, the testing declined. Even now, the guidelines say that above the age of 25 years old, there is no need to check for gonorrhea, chlamydia, unless you are promiscuous. But then normal women are not promiscuous. It's just that you never know what's happening. So the insurance coverage declined. Women became complacent. Men became complacent. It's just a myriad of factors. And then from 2016 to 18, our country saw extreme rise in STDs. In fact, there were like 450,000 new gonorrhea cases just in 2016. And then just in 2020, from 19 to 22, during the pandemic, there was a 235% increase in congenital syphilis, which means newborns born with syphilis. And that happens because the mothers have syphilis, which is undiagnosed. So at one point, syphilis had almost been eradicated from here. When I did my residency, even in 2000, we hardly saw syphilis. And now we're giving penicillin so commonly. So yeah, we need to get a handle on this. And the only way we can get a handle on this is by getting tested and getting care, because there are cures available.
I mean, it's really disturbing to hear that STDs are on the rise, and but your message is that it is curable, most if detected in time.
Absolutely. Absolutely. It's curable. It's not like, something that you're going to have to live with. And if you don't get it treated in time, you can have infertility and, newborn deaths in chronic infections. So please just get tested.
And what is your advice to young women, especially who are in this time of where there's so much change going on?
Use condoms. And if you're allergic to latex, then if you use latex-free condoms, they do have lower efficacy, meaning protection from STDs. So you should get tested. And do not be afraid to ask your partner to show you actual paperwork of negative STDs. There is really nothing wrong with asking your partner before you jump in as to show me proof of your results. And same thing, be proud and get tested yourself and be ready with your paperwork if you're, into sharing. I think honesty and transparency is key.
Thank you so much. Emily says, I'm hearing that clearer messaging is needed about the purpose and benefits of the annual exam beyond birth control. And Miriam says, are there any kinds of checkups that are free to all women regardless of insurance? And Debbie also asked a question about how do you handle insurance and out-of-pocket expenses?
So we, all of our offices, we are in network with most insurances, including Medicaid, HMOs, like Health First, Fidelis, and all of the primary PPOs. My main goal with Walk-in GYN Care was to not restrict access to anyone. That's why we don't have any concierge style or membership fees or anything like that. So if you have insurance, you can just walk in. If you don't have insurance, we have very good competitive self-pay pricing. I designed the Well Woman package to offer to women who have high deductibles or don't have insurance or are just visiting as tourists or transiently in the city. So the Well Woman package covers pap testing, STD testing, and birth control prescription. As far as free clinics question, that there are certain city-funded free clinics, which are called FQHC, Federally Qualified Health Centers, so women can go there. We unfortunately don't have free services. We do not have any government funding. We're, at one day I do want to open my non-for-profit and be able to offer those services. But as of now, we are in network with almost all insurances.
And is there something that the government makes mandatory to be available to all women? Is there any health services like that in some countries women have much better opportunities for healthcare, right?
I agree. But here, there is no such mandate. In fact, the guidelines every day keep coming and saying you don't need HPV testing, you don't need pap testing every year. Now it's gone to every 5 years. But women need to understand that's statistical analysis for a different population. We should absolutely go get tested every year. Even if you don't get a pap, to follow up to that question about what else in the annual visit rather than just birth control, just a simple full exam, we will detect any ovarian cancer, ovarian masses, breast masses. So it's an opportunity for your physician to have a full checkup and full discussion with you regarding your body.
Walter Greason, who's been a guest on the show, says, how can we expand the network of supporters in small communities to increase access to these services?
Walter, by spreading the word, acknowledging this through social media, Facebook groups, and local, I guess, health fairs and community fairs is how, and partnering with maybe a local physician who I'm happy to, collaborate with as to how we can increase access and provide care. The big problem is also a shortage of physicians in the country. We have a projected shortage of at least 27,000 OBGYNs by 2045 because the residency spots have stayed the same, whereas obviously the population is increasing. Over 30 major hospitals have closed their doors in 2019. And that's because of lack of funding, increasing costs. So there is a very big looming problem that's going to happen, and women's health is really going to be affected.
So sorry to hear that. That's very worrisome. Dr. Sujana Chandrasekhar, our ENT surgeon, says, how do you advise teens, young women with heavy, irregular, sporadic periods? Is there something to the period underwear causing menstrual issues? So please explain, if you can, the question and then the answer.
The period underwear ads and the devices, I guess devices are there all over. No, I don't think the period underwear is the one that's causing the problem. I think rising issues in terms of diet, lifestyle, polycystic ovarian syndrome, which is another passion of mine, external chemicals and, BPA, and we call them xenoestrogens. So basically things that we consume through plastics and perfumes and even pesticides go and create havoc and create estrogen progesterone imbalance. And that has led to younger and younger teens getting periods and heavy periods. So my suggestion, please take your kid or, advise the teen to go seek a physician. Do not be afraid and don't wait for sexual activity to be able to see a gynecologist. I see sometimes young girls as 9 years old, and we have to just counsel them through because the poor 9-year-old doesn't even know what's happening to her body.
Thank you. There's been discussion of our period starting earlier in American girls. What do you read about that and know about that, and compare it to what you know from your colleagues around the world?
It's definitely early periods and late menopause is happening a lot, and that's again because of our consumption of all these chemicals and pesticides. In the US, the lowest accepted limit of BPA is way higher than what is accepted in Europe and Canada. So that's a whole another discussion, and we have to be just aware of our lifestyle, what we eat, what we consume, and be healthy.
Okay, we'll take a couple more questions and then we'll go to our go to the paper. Patricia asks, is Dr. Gupta have any programs or is planning to do anything with schools to raise awareness in schools?
Patricia's been on the spot this whole time. That's my next goal. I've been trying to do more and more educational seminars and support groups online, but I want to be able to reach out to more schools and do this as an ongoing education. I just wish I could clone myself, Patricia.
Well, you certainly, are doing your part. So that's amazing how you're doing all this. Can you talk a little bit? Here's a question from Diana about any work you do with the transgender community.
Yes, we have our doors open for all transgender people who need women's health care, and absolutely, we do have patients who come in. We've I've been trying to see if I can open up the centers for a separate few hours where they can come in without any feelings of being different. But yes, our providers are trained on how to manage the hormones and care for transgender people. Absolutely.
Sudha points out the story, the horrific story of the young girl, the 10-year-old in Ohio, because of the rape, the abortion law already kicking into place, that she had to be taken to Indiana to get an abortion. We know Indiana is a state that is very conservative, but the abortion laws hadn't been triggered yet because of the Supreme Court ruling. What a terrible situation that is.
I know. It just, yeah, my heart bleeds out for these kind of situations. That's why awareness, education, and just, yeah, being on top of yourself is extremely important.
Chitachi is watching from Fort Lauderdale and says, good morning. Thank you for joining us. And Debbie says, thanks for speaking about PCOS. 5 to 10% of young women, especially South Asians.
Actually, Debbie, it's way more than 5 to 10%. At what we are seeing right now is almost 30 to 40%. Young girls are suffering from hormonal imbalance. They may not qualify for the full definition of PCOS, but the hormone imbalance triggers in. And as I educate my providers as well, it's a syndrome, and that it's a pendulum that can swing from no symptoms to full-blown symptoms. So I think most women in the US right now are somewhere in that pendulum.
And Debbie asks, do you work with midwives and support that option in deliveries?
We do have midwives on our team, and we work with nurse practitioners and PAs. In terms of obstetrical care, we care for women up to 12 weeks. We don't go all the way to the delivery care because the malpractice insurance and malpractice issues in New York, they are out of control, which is another thing that we actually need to raise awareness of. Most OBGYNs are quitting OB because they're not able to just survive. So the way the system is now transformed into is the hospitals take care of deliveries, and then we care for women before and after their pregnancy care.
And the preference of doctors like you would to not have to stop at that point, right? That in-between point.
Yeah, absolutely. I mean, my patients who have been loyal to me for years actually cry in the office and say, what do you mean you can't be able to deliver me? But I am like, my hands are tied. But they come back to me after delivery, and we make sure that they get the right care.
Okay, folks, we're talking to Dr. Adeeti Gupta, who has been sharing such important information for all of us. Please tag a friend so they can watch after, or they can join us and ask questions as we're going along. This is the New York Times Read Along on Sundays at 8:30 a.m. Eastern. At 10 o'clock, we'll be off the air, and the show will rerun on Facebook, Twitter, YouTube, and LinkedIn. So please follow at Walk-in GYN Care on Twitter, and go to the website walkingyn.com, and please follow the work that they're doing. And thank you so much, Dr. Gupta. I'm going to turn to the paper and get you to read the paper with us and talk about what's happening in the news. Obviously, lots of things to talk about with women's health care. The lead story in the New York Times is fearing and the oil jolt. U.S. pitches plan on global prices. I think I'd read this at UN pitches plans, but this is the U.S. is pitching plans. Untested idea pushed effort to keep Russian crude flowing while punishing Putin. Wow, that sounds very complicated. The Ukraine war, now a battle of endurance. Global fatigue testing commitments of the West. And Dr. Gupta, you've seen that people are discussing the war less in recent months, but the journalists have been covering it, and people are dying every day. This is an investigation into sexual misconduct in the JROTC. This is the Junior Reserve Officers Training Corps, a leadership program sponsored by U.S. military at high schools. And obviously, women's health includes issues about sexual abuse. And what do you advise your patients, parents about dealing with various kinds of issues around sexual abuse and harassment?
This is such a this makes my heart cry. It's so sad that young girls go through this, and then it keeps happening. It's not, doesn't stop after one or two episodes. I really feel that we need to empower young girls from very young age. And I know it sounds really sad that you have to teach an 8-year-old or a 9-year-old what sexual violation could be, what sexual abuse could be, and what forms it can take. But that's how young we need to start, so that they don't have to feel helpless and just let it continue. And parents need to also understand and empower their kids and actually pay attention to any changes that may happen in their kid's demeanor. If the kid is, not sleeping well, is anxious to go to the training program, is trying to, come up with excuses of how they don't feel well. All these are little red flags, and don't just blame it on just because she's a teenager. You can ignore this. Sri, you're muted.
We'll be talking about this story when we get to page 8. This is about a city of joy and grief, about babies born just steps away from fallen soldiers are laid to rest. We'll talk about that in just a minute. In Sri Lanka, the situation with the leader, the president has been ousted, and the prime minister's home was set on fire, and so they both resigned. And this is a story of mismanagement, story of fiscal mistakes made by the government, taking on huge loans from the Chinese government, all kinds of things. So if you've seen those photographs or video online, they're just terrible, poverty being made much, much worse. In 2018, we were visiting, and it was a completely different place. Earlier, Dr. Sujana had said that we should read this New Hampshire Town's Lessons in Democracy, so I'm looking forward to reading that story. And this is Joe Biden at 79 shows signs of age, and aides fret about his image. And that's something that obviously will be part of the discussion going into the 2024 election cycle. On page A2 and A3, there's a flashback here, headline in history, Princess Elizabeth to wed Lieutenant Philip Mountbatten. This is 1947. Of course, since then, she has gone on to be queen, and they were wed in 1947 and married for 73 years until Prince Philip's death in 2021. Let's keep going. In Hong Kong, pilots restore a warm memory on wheels. I guess this is these double-decker buses they're talking about. And this is just an example of what we saw. They stormed the presidential palace in Sri Lanka, and they were sleeping on the president's bed, swimming in the president's swimming pool, things that the culmination of months of fury over an economic crisis. And here is the shooting leads Japan to reassess security. This was about the assassination of the former Prime Minister Shinzo Abe, and something that will be discussed for a long time. Some experts see attack as success, not failure of Japan's gun law. This was a homemade gun, maybe 3D printed or something, that resulted in this shocking assassination. And here's a story about abortion rights in Mexico. A Mexico justice's path to aid abortion rights, raised Catholic and swayed by feminists. One of the things that will surprise people is that there are several countries that are majority Catholic in the world that will now have better women's health rights to abortion than the United States. And then here is, at any given moment, it's like parallel realities. Even amid relative peace, powerful reminders of the war overtake the daily rhythms of life in a vibrant city. You've obviously been in the room when birth has taken place, the miracle of it. Here's a story about the juxtaposition of the newly born and the funeral. So if you can share what you're thinking.
Yeah, it's a really sad state of affairs. But, it's a cycle of life. And I know healthcare providers there, nurses have been working super hard to give safe care to these newborn babies. And I just hope that these newborn babies are able to survive, bring on new light, and, grow up to be strong citizens.
Yeah, you know how complicated birth is even in the best of times. And imagine with bombs dropping around you, and how they do it is just stunning. And we have to think of our healthcare workers. During the pandemic, as you know, there was a lot of attention paid to frontline workers and nurses and doctors and all of that. Do you feel that in the months since, we've gotten kind of complacent about that as well? And you remember the cheers and everything that people used to do, and now have we gone back to where we were before in an appreciation of the healthcare industry?
Yeah, I was very appreciative, and every evening, 7 o'clock, I would, being in Manhattan, actually get emotional every time there were cheers. Unfortunately, what we as a society and population have to realize that the pressures on healthcare system have not reduced. In fact, they have actually gotten worse. The healthcare staffing shortages are at the highest that they've ever been, because people are either out of their workforce or they've started to travel. I don't know if you've heard of this. Traveling nurses are being paid a lot more, so they are just not there. The hospitals and healthcare systems are having a hard time hiring staff, and we're having the same issues. So my healthcare team is actually working extra hard, extremely short-staffed, but they're still committed to the mission, so they're still working. So yeah, the awareness of the pressures on our healthcare system actually needs to stay on high alert.
Hearing that ambulance behind you, Doc, reminds me about how that was kind of the soundtrack of the city during the peak of the pandemic, and we got used to that. And in a way now we do notice these sounds which we weren't noticing in 2020. So that's a good sign. And of course, somebody's getting urgent health care right now. And hopefully that whoever that ambulance was for has a happy resolution of their health situation. Johnson resigns, but his legacy and divisions are that he stoked remain. Successors will have to wrestle with Brexit and its issues. Now in Cheney's corner, Democratic donors. This is about Liz Cheney, who has been outspoken about the January 6th insurrection. Former officer who shot child exits new job after 2 days. This is the story of Tamir Rice, The officer shot and killed Tamir Rice, who was 12 years old, playing with a toy gun in Cleveland. And this particular officer got a job as the only police officer in a small town in Pennsylvania. And because of the pressure put on by the public, he was forced to resign. Police estimate 13 guns used in a Harlem shooting, underscoring how prevalent firearms are in New York. In New York apartments, ants go marching up. A new pest above ground level comes as a shock for urbanites. I am glad I have not seen this in my apartment building, but that sounds like a real problem. But look at this, the ubiquity of this type of ant it's known as the Manhattan ant. Across New York speaks to the industrious insect's adaptability. I've not heard of the Manhattan ant before. I don't know if you have, Doctor.
Not really, but I'm not looking forward to more pests in our city.
Yeah, this is another look at the ROTC story, and this is about teens abused by the ROTC members. The program targets high poverty schools to encourage them to look at careers in the military. And you can see that high poverty and rural areas are targeted, and it becomes hard to resist these sexual assault stories. We are up to the obituary. I like reading obituaries. I don't know about you, Doc, but they tell full stories of the lives of interesting people. So I'm always looking at these. And here's a former president of Mexico, dead at 100. Hunter Reynolds, 62, artist whose work evoked the heartbreak caused by AIDS. And we had talked about this earlier in the episode about the amount of attention that people paid to AIDS, and as a result, safe sex, and how that seems to have changed in the last few years. And the doctor spoke about that very well. And then for anyone who's a fan of The Sopranos, Tony Sirico has died. He was Paulie Walnuts on The Sopranos. He was 79. And one of the writers on The Sopranos said that the first day he met Paulie, and he introduced himself as a writer to Tony. I'm sorry, he's not Paulie. He'll always be Paulie Walnuts to me. He said, the day you write the script that Paulie Walnuts has died, two things will happen. Paulie will die, and then you will die, meaning the writer. So he understood, and he was kept alive as a result. Do you watch The Sopranos?
I did not, but that's on my list to do, a whole thing.
What are the TV shows that you watch and recommend, or do you not have time?
No, and I do like to watch at least during dinner time. So that's my guilty pleasure time. I'm a big nerd. I'm a Doctor Who and a Star Trek fan. So I've been on those like whole series nonstop kind of thing every night.
Wow.
I just finished watching Pine Gap. It's on Netflix. It's actually pretty interesting.
Okay, I've not seen that, but thank you for the recommendation. Since we're talking to a business executive, let's talk about an entrepreneur. Let's look at the Sunday Business. Cover is When Tabloid Fiends Need a Friend. This is a law practice specializing in headline-grabbing defendants who are hated by many, and lonely last days at a suburban office park, a different kind of emptiness in this with what's happening, of course. And here's a question in the Work Friend column about cake and celebrations at the office. How do you handle them in the office? And what do you do to encourage people to have kind of the camaraderie and friendship?
So we, since the day we opened, I am very particular. We buy a cake for every employee's, every team member's birthday. So we celebrate every birthday for everyone all the time. And it's really nice. We have tons of pictures. People get excited. I think it's a special thing, you can do for your team.
Here's a cover of the Sunday Styles on Prozac Nation was just the beginning. This is about the rise in prescription drugs. Can you talk a little bit about mental health and how it connects to women's health?
Yeah, I actually saw that, and I was going to comment earlier too. Mental health has obviously been at the forefront with people being, stuck in their houses, and depression and even domestic abuse. My very strong recommendation is to please, again, get proper help instead of relying on online platforms to ship you antidepressants, because the antidepressants can create havoc with not only your brain, but also your hormones. So for women, it's extremely important to know that don't just pop in pills, but please ask your providers um, the correct questions.
Thank you. The modern love column is the pregnancy, the marriage, the pearls, all lost. At 18, she didn't want to be the captain of her own fate. 14 years later, she is. And this looks like a fascinating story, as all of these are. And this is the continuation of the pills and prescriptions story. Prescriptions for mental health medications have increased during the pandemic. More Americans are depressed, anxious, tired, and distracted these days. There's a column here, the social cues, where we read out one of the questions here. And this is fun. There's no right or wrong answer, doctor, so I'll just ask you your opinion. When a host asks for the least, I was raised never to appear empty-handed at social events. I like to bring food for the host table. I always ask what might fit their menu. Recently, we went to a dinner at an aunt's house. I asked if I could bring a dish. She said it wasn't necessary. When I repeated my offer, she asked for crudité and hummus, which she never served. I learned later that she was insulted that I brought the food. How can I avoid a situation like this in the future? So no right or wrong answer. Would like to hear what you think. As a fellow Indian, I know you were also raised this way, that always ask, what can we bring? What do you want? Etc. We went to dinner yesterday and we asked, and it was very clear. The host said, if we don't need to bring anything, but if you'd like to bring something, bring a dessert. And then we were able to do that. So your thoughts?
That's funny that you say that. I was raised exactly the same way, never go anywhere empty-handed. And actually, my partner, he's American, so we always have this discussion before going to anyone's house. He's like, they said don't bring anything. And I will be like, no, I'm going to bring anything anyway. So I always do bring something. I don't care. They may or may not serve it, but, a bottle of wine or a cake or, like you said, something.
Well, here's what Philip Galland says. Try listening better. I love your generosity. Briant probably wasn't offended by the offer of the food. She was more likely put out that you ignored her answer and persisted in asking what you could bring. People like preparing dinners on their own. The next time a host refuses your offer of food, bring a small gift to be used later. Some fancy olive oil or a thriving pot of spearmint. You can respect the spirit of your upbringing, I think, without being bossy about it. So I think that's fair. A bottle of wine, nobody will be upset about that. So.
Yeah.
And we're just looking through the vows section and the rest of the styles here. Let's keep going. The Sunday review is about the mayor who never sleeps. Eric Adams of New York is revealing himself to be the man the city needs. So this was an interview with the mayor by Maureen Dowd. What else are we reading about? Love doesn't make you an enabler. Codependency is a toxic and harmful myth in addiction recovery. So that would be an interesting essay to read. It's time to stop living the American scam. Which is the American scam? We've been productive enough. In fact, we've produced far too much. As you know, doctor, in some European countries, people work a lot less than we do here. How do you think that affects women's health?
I think we are in America under a lot of pressure to produce, to work all the time. I have been very insistent on educating women and not just our team, but patients too, is to create boundaries and have a healthy protocol. I call it the shutdown protocol. End of the day, after 5 o'clock or 6 o'clock, you have to stop looking at devices and create boundaries and do the family time, try to sleep on a schedule, spend some 5 minutes a day to reflect and breathe and, think of what went well during the day. So yeah, we need to develop routines for our mental health.
Thank you so much. Here is Dr. Chandrasekhar's comment. That's so funny. I always bring a hostess gift, even when I'm the guest speaker of a big university function. For that, I bring a textbook I've written to leave for the trainees library. So that's very cool. And Sudha says, Sujana, that is a great gesture. Guns aren't sacred. National mythology has hampered our ability to respond to gun violence. I'm terrified for my patients. Well, look at this. As a high-risk obstetrician, I know how dangerous some pregnancies can be. So this is David Hackney, a maternal fetal medicine specialist and the chair of the Ohio section of the American College of OBGYN. So that will be something that I'm sure will be discussed in your circles. And how the Biden administration could protect abortion rights, are women being erased, and American moms need a break. Amid a formula shortage, new recommendations say to breastfeed longer. So can you talk a little bit about the formula shortage?
Yeah, so I am a big proponent of breastfeeding, and it's not just me. Being in India and having contaminants in formula or water, like lack of good quality outside stuff, our recommendation always was to breastfeed for as long as you can, because that is the safest food that you can give your baby. In addition, breast milk increases immunity. I don't know how much you know, but it reduces chances of allergies and gastrointestinal issues when the kids grow up. Unfortunately, somewhere along the line from the 70s, it became not fashionable to breastfeed anymore. So the formula supply became a whole thing. So I think we need to get back to our roots and give the safest method of nutrition to the baby is through breast milk.
But of course, not all women can produce, and the babies don't latch, and all kinds of issues around that as well.
Right. And education needs to start from before you get pregnant on how you can get your bodies ready. But yes, we'll still have those few women where we cannot breastfeed.
Next time, Trump won't need a mob. The GOP wants to give states the power to overturn elections, and 10 voters debate political courage. What characteristics make a good leader? Effective communication, passion, compassion and understanding, not being afraid of doing what's right no matter what everyone else thinks, consistency, straightforward, no sugarcoating. This is also entrepreneurial leader also has all of these leadership qualities, as you can, I'm sure you will agree as you look at what's happening. Real estate, this often is focused up almost exclusively on residential real estate, but all the work that you're doing, opening clinics and all of that, how is that affected? How is the commercial real estate business in New York?
Well, it's still very hot. It's still very expensive. I know during the height of pandemic, we did see a downturn, but we just moved to another bigger space in the Manhattan office. It's a really beautiful space, but it is, it's not any cheaper. So I think the real estate downturn that happened during the pandemic has reversed.
The Metropolitan cover is about dark secret changes a friend's life. Tin Chin and Mo Lin were inseparable at the homeless shelter, but one of the men wasn't who he seemed. So that's a mysterious story that we'll look at. The book review. What are you reading these days, or what was the last book you read?
I actually just finished Thomas Jefferson's biography by Beecham. That was really good. And right now I'm reading Talking to Strangers from Malcolm Gladwell. It's a very fast-moving read.
Okay. We were talking about TV shows earlier, and the Arts and Leisure cover is about product placement in movies and how that all works. So that should be fascinating. What was the last movie you saw in a theater?
Oh, The Top Gun.
Oh, you did? Okay. Yeah.
I took my mom to see that, and it was a feel-good thriller, nice movie.
Okay, good. That's a strong recommendation from Dr. Adeeti. And this is about how the circadian medicine researchers are trying to figure out the right hour of the day to do everything. Can their studies sync us up with better health? I don't know if you've had a chance to read this, but what are your thoughts on this idea? There's so much research being done around this topic.
Yeah. So what we need to understand is that the right time of the day for everyone may be slightly different. But we need to understand, like they're mentioning the circadian rhythm, where your melatonin levels rise, cortisol levels rise, and we have to consistency is key. So this is why night shift workers should try to keep their night shift schedule if they can, because when the whole body gets messed up if you are switching around your sleep wake cycles. And that's why I was mentioning the shutdown protocol or wake up protocol. Having a ritual around it is extremely important.
What are your rituals, Doc? For those who missed it, the doctor is up by 5:30, going to the gym before she starts her day.
Yeah. Yeah. And then stay off of emails and, stuff like that after 7 o'clock, 8 o'clock.
Okay. Debbie asks, how do the modern stresses on women affect our hormones? We need more research on women's hormones and mental health.
Absolutely. So I call it the brain vagina connection. We have the stresses affect your cortisol levels. Cortisol levels go and affect your brain, hypothalamus, pituitary axis, then your adrenals get affected. So, and then that affects your estrogen, progesterone production. Everything is extremely interrelated. That's why our mental health is absolutely directly related to how our hormones are working. So, working and recognizing your stress is extremely important.
Thank you, Doc. My wife and I lied about our son's death. Can I come clean if she won't? This is the ethicist. And again, there's a question here. I'd love to hear, your thoughts on this very serious question about a man whose son died of an accidental overdose of a fentanyl-laced pill. They decided to keep the cause secret, but now he wants to talk about it. And so the question here is, I believe that we're morally obligated to speak out, even if belatedly, because it may save another family from tragedy. I'm ashamed that it has taken this long. Can I ethically go public with the real cause of my son's death when his mother and stepfather are against it? Again, no right or wrong answer. This is an ethical question.
Yeah, I think he's right. Like he could save many more families by creating more awareness. And I mean, he was a father, so he has the right to share the story. I know there's a huge stigma attached with it, but we need to remove the stigma and approach this in a healthy fashion.
Okay, and Professor Apaya says, your explanation shouldn't hang on the possibility of, but unless you're planning to take part in a document, publish an article, the chances of anyone changing paths are slim. It's clear that lying never sat well with you. Explain what you want to do as a matter of coming clean for its own sake. Not every act needs to be defended ethically by appealing to the consequences for others. So that's an interesting approach on this. Do you find when you're dealing with, especially with young girls, that getting them to open up to their parents, their mothers is hard? And how do you draw the line where you don't share information with their family, when even though parents might ask?
Oh, we have strict rules on privacy. If I have a young girl who comes in, we do require a guardian, depending on the reason they're here. Thankfully, New York State has the emancipation law. So if a girl is seeking care for birth control or STD testing, or anything related to sexual health, then they don't require a guardian. So we are very careful about sharing information with the parents, even if they call. If they're not on the privacy papers, then we will not share information.
Okay, let's talk a little bit about food. Tell us about your cooking habits and times, and what are the kind of things you like to do? What is your kitchen experience?
Instant pot. For for someone with my schedule, I just prepare a whole week's meal of like cruciferous vegetables or something, and that's again very good for women's health, and for the whole week. And I love my hummus and veggies.
So you're a proponent of that. That's great. So here, Brian Washington is saying, bring on the biscuits. The homey breakfast classic gets a punch up from kimchi and cheddar cheese. At the heart of it, you're looking to make a dish that makes your people feel good. What is the connection between food and women's health?
Huge, because the type of foods you consume affect your estrogen balance directly. As I was mentioning, all the pesticides and xenoestrogens, we have to be extremely careful. And also, like tofu and things like that contain phytoestrogens, which can stimulate estrogen in the body. So we have to be careful about what we're consuming.
And are there certain kinds of foods that you always recommend? I know you mentioned the hummus and fresh vegetables. What else?
Fish, 2 to 3 servings a week are extremely good for us. Increased protein intake is important. Cutting down on dairy and gluten as we age, our bodies start to become intolerant to that. So recognizing those signs, it's green vegetables, Brussels sprouts, cauliflower, they're your best friends.
Here is an article about Yuval Sharon is seen by many as a future of opera. So why did he take his radical vision to a mid-sized company in Detroit rather than one of the big places? Are you an opera fan by any chance?
No, not really.
Me neither. So, but this is still should be interesting to see. He could have gone anywhere, including the Berlin State Opera and others, and now he's in Detroit. And this is about the circadian article says circadian medicine researchers are trying to figure out the right hour of the day to do everything. Can their studies sync us up with better health? They call it the time of your life. What have you found in terms of what are some things that work better in terms of encouraging you to sleep? What do you recommend the amount of sleep that people need in order to be healthy for your patients?
So the amount of healthy sleep varies with the age, how old you are. As we've seen in recent research, teenagers need more sleep, 10 to 12 hours even sometimes. But 7 to 8 hours is a healthy, period to sleep. I also focus a lot on holistic health and comprehensive care of hormones. So we do full 28-day testing of the hormones, and we see the curves up and down for melatonin, cortisol, estrogen, progesterone, and then we can show you a window into your what your body is doing. And I think more practitioners need to learn how to be able to provide that level of care.
That's so important. Thank you so much, Doc. Look at all these very interesting ways in which they're illustrating the story. And this is important. Once you find that every cell in your body has a clock, then you want to know, well, what's it doing at every hour of the day? And that becomes part of the story as well. And then high trauma and mine. After my partner was brutally beaten on the street, I became one of many thousands of Americans caring for someone with PTSD, and our relationship changed forever. Can you talk a little bit about the partners of the women you work with and how you advise them to work with your patients?
Before the pandemic, I was when we were allowed to have the partners in the rooms. It's really good to be able to talk to them together as a couple, and then have talk to the woman in private, because men are not. Well, I shouldn't just say men, like partners aren't really aware of what their partner may be going through. So educating them and empowering them to be able to help their partner is extremely important. For example, a man may not even know, why the mood changes are happening before the period, and they're just assuming, oh, she's going crazy, it's that time of the month. But spreading awareness on why it happens and that it's fixable and we can help is extremely powerful.
And do you think men have an understanding of women's health in general, and what do you recommend we as men know and pay attention to?
So that would be another project of mine, is actually creating awareness just for men. No, men do not have clear awareness, and unless they were brought up in a household where they have sisters and the mother, and they are talking and openly talking about it growing up, it's a huge mystery for them. And I know they intend well, they want to help their partner, but they need more guidance and education. And the women can take control of that by sharing all that information with their partner and creating an open and transparent relationship.
Thank you. Here's crossword puzzles. Are you a crossword puzzle doer?
I used to I used to actually design crossword puzzles. I've lately not been great at doing them.
Oh wow, that's amazing. This is the first time I think I've seen a Indian byline on the ripple effect by Prasanna Sheshadri, and this is a more complicated. That's a numbers based one here, and a cryptic crossword and the Sunday crossword. This time edited by Will. I mean, it's always edited by Will Schwartz, but Christina Iverson and Scott Hogan. Scott is making his New York Times debut with his puzzle. How did you get into making puzzles? They're hard enough to solve. Making them must be even more complicated.
Oh, it's really fun. I did it in school a lot, and then med school too.
In med school, this is your way to relax, maybe?
Yeah, exactly.
That's great. Tell me about the. I'm sure you don't have a lot of time for the news, but what is your relationship with news, and also what you see on with misinformation and disinformation as people who use WhatsApp in our community. WhatsApp is a major problem because of the bad medical information and health information that's shared globally all the time.
Yeah, I just wish that news was more objective and actually catered to objective data. There are tons and tons of online blog articles, and as we say, Dr. Google, Dr. Google will now see you. And there's so much. Basically, on the internet, you can find what you want to find, whether it's supporting your diagnosis or it's against your diagnosis. So again, trusting your physician who has been through the med school and experience and all that training is extremely important, because the media has reliance on internet has created a lot of distrust amongst general public.
Yeah, and that's certainly something that is spread so fast online, especially with the messaging apps as well, because they sometimes there's a kernel of truth in it, and then it's blown out of proportion, or it's actively, deliberately faked information and data and stats and all of that. Jonathan Borstein, who's watching, says one of the problems I had was taking care of my mother was doctors who talked to me instead of her. So that's interesting. So he's talking about how doctors might focus on talking to the man instead of the woman in a situation. In this case, a son and mother relationship.
Yeah.
And
I was going to say, I used to have some situations where the husband would be answering the questions when I'm asking the woman about, so how's your period? Are you feeling pain? And the husband's like, yeah, her last period was then. I'm like, I'm not talking to you. She's the woman. It's her body. So the doctor definitely has to take control of that conversation. I agree with you, Jonathan.
Yeah, I'm sorry, I didn't mean to laugh, but I can see that totally happening with men. Patricia says, do you have change of life awareness for us older women too?
Don't quite understand the question.
No, I guess you were talking about like change of life situation with young girls and teens and all of that. So, what do you advise older women and their change of life?
Oh yeah, as soon as you turn 40, your body's going to start changing and you feel the difference. So, being aware of your level of energy, your sleep schedule, how you're feeling, even sexual libido and desire, it will start to change. So you need to pay attention to it, and there is a solution. So again, I'm heavily focused on comprehensive full life cycle care, not just pregnancy. So because a woman is woman all her life, right? You're pregnant only for 9 months. So very, very important to learn more about changes that your body may be experiencing.
Yeah, and of course, many women never get pregnant.
Right.
Dr. Chandrasekhar says, mansplaining our own periods, that's next level.
Yeah.
And Jonathan says that if you don't laugh, you'll cry, because that's certainly how we felt. Ken Fisher says, I appreciate so much your work, mission, Dr. Gupta. I wish to borrow your expression, shutdown protocol.
Go for it. Please borrow, spread, share.
Please explain it to people who are just joined us and may have missed it. So a chance to talk to us again about it.
So that teach your body that it is time for me to now stop and relax and focus on my sleep. Your body has to get prepared to go to sleep. You can't just say, okay, I'm going to turn the lights off, turn my video off, or some people even sleep with the TV on. it's not going to be the sleep, high quality sleep that your body needs. So having a ritual around going to bed, maybe reading 4 lines, reflecting on the day, spending 2 minutes meditating, um, not checking emails, all that is extremely important. So developing a plan for your day and night, both are important.
Okay. Debbie asks, how can fans support your work? Tell New York City friends, suggest articles, make a national movement.
All of it. I would love all of it. So please, yes, spread the word in Los Angeles, New York. I'm working on developing support groups, free support groups for PCOS, PMS, and telehealth, with telehealth support. So I will share the links as I launch those groups, and hopefully young girls can join as well and learn more.
And of course, we'd love to have everybody follow you and follow the company on Twitter. And that's Walk-in GYN Care. And the website is walkingyn.com. Very easy to find. And the hashtag is just walk in. So please check out the work that Dr. Gupta is doing and spread the word. We're going to take a little pause here to do a little bit of housekeeping. And then we're going to come back to Dr. Gupta and ask her what is a piece of advice she has for journalists about women's health and what they should be thinking about. So we'll be right back, Dr. Gupta, to you. Give you a chance to catch your breath.
Thank you.
And welcome to the show again, Neil. You and Paul have been working very hard backstage. I also saw that there were a couple of birthday greetings to our colleague and friend, Steve Taylor. So happy birthday, Steve. Neil, I learned so much today.
Absolutely. I think it's such a timely conversation. Some really good information for both men and women, right? I mean, these are just to know that these services are available. Some of the education that Dr. Gupta shared, but also for men to understand that they have a role to play in helping their partners. I think it was another great show, and really we've had a number of shows that focused on medical issues, and of course, Dr. Chandrasekhar and Dr. Marina Korean. During the start of the pandemic, we added a half hour to our show to focus on healthcare, and then we spun off and launched their own show as well. So we're definitely thankful for Dr. Gupta for joining us this morning.
Yeah, this is so important. And also, by the way, I found it fascinating to read the paper through her eyes. We have a lot of New York Times guests on the show and journalists on the show and authors and writers. So as a non-journalist, getting her perspective was very important.
Absolutely. And a lot of healthcare, a lot of women's health issues in the paper. We do have a couple of announcements we want to make before we bring Dr. Gupta back on. Of course, we want to thank Paula for her work in Facebook and LinkedIn, engaging with their audience, sharing links to articles, sharing links to Walk-in GYN Care, etc. So thank you, Paula. And of course, the show is produced by Digimentors, the consulting firm that Sri co-founded. As you know, we produce hybrid and virtual events. We also do social and digital consulting, training, and workshops. If you're interested in having us work on a show like this for you, or if you're interested in social media consulting, please get in touch. Our email addresses are below, sri@digimentors.group or neil@digimentors.group. We'd love to talk with you. We've also done a series of hybrid events lately as well. We want to give a shout out to our sponsor, Muck Rack. Muck Rack has been a longtime sponsor of the New York Times Read Along. Thank you for your support. If you're interested in being a sponsor, you can reach out by email as well. We want to give a shout out to the Local Connection newsletter. The Center for Cooperative Media at Montclair State University brings you the Local Connection newsletter each week. It offers story ideas and pro tips for journalists. And best of all, it's free. You can subscribe at bit.ly/local news tips, bit.ly/local news tips. And a programming note, we want to make sure that you catch the Women to Follow show on Tuesday, July 12. Our colleague Rose Horowitz is hosting a show, Frontline Care, a talk with OBGYN Dr. Camille Clare. Another timely discussion, a great follow-up to today's conversation. So you can catch Rose Horowitz's Women to Follow, amplifying women's voices on social media, Tuesday, July 12th at 8 p.m. Eastern, 5 p.m. Pacific. That's 8 p.m. Eastern and 5 p.m. Pacific. With that, Sri, I think we're ready to bring back Dr. Gupta. Dr. Gupta?
Welcome back. Thank you so much for being here, Doc. You were fantastic, and we learned so much. I do want to ask you the question about your advice for journalists, but before that, I want to ask about your concern about the realistic issues around availability of birth control nationwide after the changes that are happening now. What do you tell your patients and friends?
Safe birth control is available. We have advanced so much in healthcare that we have so many options for birth control. So my suggestion is please, please, please seek help, good care, get the right advice. And if you do find yourself pregnant, do not automatically assume that there is no choice and start trying to use unsafe methods, because I have seen how bad that route can take you. So awareness, education, asking the correct provider is the key.
Okay, thank you. And let's get a journalism tip from you. What is your advice to journalists and their coverage of women's health?
Before I get to that, real quick, my mom just texted me that she's listening to the show, Sri.
Hello, Auntie, and thank you for watching.
Yeah.
Hats off to our moms.
Yeah.
Certainly.
I mean, they are our mentors from day one. So, yeah. As far as the health tip, I really encourage the media to cover the lack of awareness around annual visits, wellness visits, and to spread awareness that, it's not just about the PAP, it's about getting care from the time that you're maybe 9 years old, 10 years old, and getting an annual visit. So please spread that message whenever you cover women's health.
Thank you for sharing that. Some lovely comments. Speaking of mothers, here's Neil's mother. Sudha says, thank you for the very good guest, Dr. Gupta, who is highly intelligent, motivating, and insightful with providing health education. And Debbie says, please speak to med schools, public health schools, university, female alumni network, etc. Your work needs to expand. Mazel tov, she says.
Thank you, Debbie.
And Walter had a comment as well that we need longer conversations about these empty suburban office parks. The world economy is fundamentally changing this decade. We need millions more entrepreneurs like Dr. Gupta. Imagine if we had millions of Dr. Guptas. We could address healthcare for all.
Absolutely. I'd love that.
And Patricia also said that this interview is factually real medical advice for free. Thank you for amazing information, spreading kindness and awareness for women's health. We couldn't agree more, Dr. Gupta.
Of course, we always say on this, she's on call, all our medical shows, talk to your own doctor. They will give you the best advice. But this is so great that we were able to have this. So thank you very much. What are your plans for Sunday, Doc?
Work. I'm going to catch up with work because once Monday starts, then it's a roller coaster.
Amazing. Well, thank you so much. What an amazing show. I learned a lot. Dr. Gupta is a gem, says Diana.
Oh, thank you.
All right. Thanks very much, everybody. And we'll see you again.
Thank you for having me, Sri.
Thank you.
Thank you.
Bye-bye.
Bye-bye.